Beyond Patient Management, Healthcare by Design by Denise Tahara and Mary McBride. Background. According to the Congressional Budget Office, as a result of the passage of the Patient Protection and Affordable Care Act, an additional 32 million Americans will have health care coverage by 2019. With increased participation, an environment needs to be constructed to encourage wellness and healthy behaviors, improve utilization, and contain costs. Today, we will continue to explore how strategic design and design management can reframe healthcare encounters and community outreach to facilitate appropriate utilization of the system and create an environment that supports healthy lifestyle choices. Designing the service experience. The strategic intent of the Affordable Care Act is to organize healthcare delivery to allow for expanded service and increased participation. The Affordable Care Act requires states to design and operate the requisite systems and support for the additional participants. But what does this really mean? What are the design challenges? We must move beyond increased participation to increased well-being. The experience must encourage wellness and healthy behavior. Let's begin the process of discovery. To respond to the increased demand, the capacity of the system must correspondingly increase. How do we simultaneously provide services to more people without reducing the quality of care and treatment? Studies have shown that individuals with health insurance use more care than those who are uninsured. Multiple roundtable discussions and panels of federal, state, local health experts identified the following key issues: need for more primary care providers, limited availability of specialists for the Medicaid population, inadequate payment and reimbursement, increased use of managed care plans, electronic health records to facilitate communication, increased safety net capacity, expansion of community-based initiatives. These solutions are all supply-side and provider-based. How and where do we increase capacity for the newly insureds? Community health centers, rural health centers, and critical access hospitals represent some of the most significant design challenges. Community health centers are a safety net provider of care. Much of the targeted population in the Affordable Care Act currently utilize or will access community health centers. Patients tend to be both racial and ethnic minorities. 72% live at or below the federal poverty level. Communities tend to have higher than average infant mortality. Transportation and access are key barriers to care. Investment in designing service delivery in these settings is essential. Systems should be designed for more holistic management of disease and lifestyle behaviors, high incidence of comorbidities, and early detection and prevention of chronic diseases. The challenge for designers is to reduce the barriers to effective use of the system. These must be designed out at the front end. For example, medical schools need to promote the importance of rural health and urban care in at-risk communities. The design of community-based initiatives, which would include school-based health centers, oral health campaigns, adult immunizations and vaccine awareness, tobacco cessation, and anti-obesity programs, would relieve stress on the community health centers by creating a community of more educated participants. Reimbursements continue to be a design challenge. We need to encourage and incentivize providers to participate in public insurance plans, particularly in at-risk communities. We need to improve coordination and continuity of services by primary care providers and specialty providers. Technology can help, but the effective use of technology must be designed in. We need to facilitate patient-focused information and communication, and design for portability and continuity of care, facilitating access to patient information. These challenges can impact provider-side capacity and capability to offer the requisite services. But when designing a system-wide improvement initiative, we must not only discover and examine all components of the system, we must also design, deliver, and redesign. Systems are optimized when participants utilize and providers deliver care in ways that maximize the benefits to all participants in the system. Strategic design utilizes feedback loops and continually upgrade and refine for changing user needs. The design opportunity. If the intent is to increase coverage and decrease overall spending, the newly insureds need to be informed about what their coverage means and how to access care, especially wellness and prevention. Community initiatives and support should reinforce the message, and healthy behaviors, including immunizations, diagnostic testing, medication management, which will decrease acute episodes of service in the emergency department. Strategic design is important at this point in time because our healthcare system is being implicitly redesigned through a series of political decisions. Defining the intention of these decisions and discovering the differences in the way care is accessed and utilized by diverse users will enable the prototyping of systems specifically designed to deliver outstanding results in terms of access, utilization, and care. A successful system cannot command compliance. It must encourage behaviors that will evidence a commitment to wellness and design in those behaviors. Designers are trained to encourage behavioral commitment to both new and familiar experiences. They design for specific demographic and socioeconomic patterns of use which can influence non-compliant behaviors, including failure to fill and refill prescriptions, pill splitting, avoidance or delay of recommended immunizations, skipping diagnostic testing and follow-up visits, delayed dental care, high medical bill debt. Conclusions and recommendations. Healthcare services should be viewed as experiences shared by users and providers. Initiatives outlined in the Affordable Care Act would benefit considerably from fully utilizing the power of strategic design at the front end of the development of the recommended strategies. The service experience should be designed to engage participants and build trust and commitment from both users and providers. Designers understand how to create touchpoints that make for successful experiences, and they know how to use design to overcome access and utilization barriers that can result in a lack of continuity of care. Design brief is essentially to design an intervention to modify risk that can engage, support, and create the outcome of ongoing behavioral change related to lifestyle that can impact well-being. Innovative, imaginative, and creative out-of-the-box thinking is needed to reach out to the underserved communities. The idea of strategic design with a specific process of discovery, definition, design, and delivery should be explored and experimented with, especially at community health centers. Such a study would help determine whether the intention to modify risk, create ongoing behavioral change related to lifestyle can be designed in and used to support the Affordable Care Act objectives. Providing effective and efficacious access to healthcare for those who are currently uninsured to improve wellness and reduce overall healthcare spending is the intent of the Affordable Care Act. Thank you.